Our practice uses recommendations from the American College of Obstetricians and Gynecologists when it comes to prenatal lab studies during pregnancy. At your first visit, we'll give you a lab slip to have blood drawn for a complete blood count, your blood type, variety of sexually transmitted diseases, and screening tests for certain genetic problems like cystic fibrosis. Later in the pregnancy, we'll screen for gestational diabetes. The lab work is important because it screens for a variety of infections and diseases which may have an impact on the health of the mother and the baby during the pregnancy and time of delivery. Certain viral infections may require a cesarean section to reduce the risk of transmission to the baby, or may prohibit breastfeeding after delivery due to an increased risk of transmission to the newborn. If a patient is found to have gestational diabetes, it is critical to work with our high-risk obstetrics doctor to manage this condition. Every lab test has a purpose, and we hope you will do your best to get each recommended test performed in a timely fashion.